visiting local businesses and meeting with Westside faith leaders to share our plans, hear their feedback, and forge a plan ahead. We've been meeting with city councilors as well. Some conversations I've had personally with the Bullock family and with Councilwoman Jennifer Farr have been so enlightening and given me a lot of hope for this program of ours. Now, many of y'all are already familiar with our clinic. The Women's Health Center has been around for nearly half a century. We've specifically been in this community here on the West Side for nearly 30 years. We are no strangers to providing patient-centered, evidence-based, compassionate care that is stigmatized. And I'm sure that if you live in this community, you've probably unfortunately had to drive past some of those individuals who have shouted their hateful rhetoric and held graphic signage while hurling insults and threats at our staff and patients in the past. But we are committed to the health and wellness of this community, and we will not ever be deterred from trying to do right by the patients that we serve. So since the legislature banned abortion last September, we resolved to keep these clinic doors open to continue serving this community that has come to depend on us as a safe, judgment-free place to receive comprehensive, affordable reproductive health care. And we looked at the data to inform our decisions, as we do as healthcare providers. And what we found is that the Westside community leads the state in opioid overdose and HIV and Hep C spread. And according to the CDC, this is in large part due to lack of access to sterile syringes. I imagine there is not one person who's here this evening whose life has not been touched by our state's opioid crisis. We know this is a deeply personal and important issue. And no matter what your personal opinion on sterile syringe services is, here's what I think we can all agree on. We care deeply about and want what's best for our community members and neighbors. We want our community members to be safe and healthy and alive. So here's what we've done so far. On World AIDS Day in 2021, we installed our city's second syringe disposal box. It's right over there. It was painted by local artist Jamie Miller. And since its installation, it has kept hundreds of pounds of syringe litter off of our community streets. We also served as the launch site for Unstuck Chuck, an innovative program that pays unhoused people $15 an hour to help clean up the community and keep trash and syringe litter off of the street monthly. We ramped up free condoms and emergency contraception distribution. And most importantly, we have hired our clinic's first ever harm reduction program coordinator and outreach organizer, Iris and Hannah. Where they at? Yeah. I'm going to pass it over to Iris, who will share more about our plans to launch a sterile syringe service program, the specifics about the program and its protocols, the extra support services that we'll offer, and so much more. And then finally, Hannah's going to wrap things up for the evening with some key updates and calls to action. I just want to say one more thing. Recovery starts with survival, and our harm reduction program will help people survive, plain and simple. Thank you.
Hi, everyone. Like Katie said, my name is Iris. I'm the harm reduction program coordinator here. I wanted to talk at you all without notes, but then I forgot my keys like 8 times today, so I think that's probably not a good idea. I'm gonna keep it short, I promise. So we're here tonight, like Katie said, to spread the word about our harm reduction program and our application for a syringe service program license. We're here to continue the conversation that we started when we began knocking on doors, reaching out to community leaders, and visiting businesses and calling churches on the West Side a month ago. I know that harm reduction, especially when we talk about syringes, brings up a lot of emotions and questions and concerns. We want to hear your stories, answer your questions, and make plans to incorporate or address your concerns. I want to clarify a couple things and answer some questions that you might have about this program. When a lot of people hear the phrase syringe service program, they think needle exchange. The fact is that the name is kind of a misnomer. Syringe exchange is one part of a large, well-rounded program that we hope to offer this community. At our program, people are going to be provided with naloxone and training about how to save a life. They'll be given wound care. They'll be seen in-house for HIV and hepatitis C testing and treatment, reproductive health care, routine health screenings, and more. At every meeting with me, and everyone who comes to this program, at least right now, will be meeting with me. Participants will be offered referrals to primary care, behavioral health care, substance use disorder treatment, and more. And I'm currently building out a network of places where I can refer people to food, housing, help with ID documents, and more. Thank you. All of this is going to happen in a safe, secure clinic environment with a welcoming and non-judgmental interaction. This program is not just for women. I get that question a lot. This program is going to serve everyone. It's not just for people who use syringes or people who inject their drugs. It's for anyone who uses drugs or substances and wants to lower their health risk and be connected to resources. Any positive change, that phrase over there in the beautiful silver balloons, is there because it's one of our harm reduction mottos. We celebrate any positive change, whether that means someone making the switch to using clean syringes and drastically reducing their risk of HIV, hepatitis C, and all of those things, or whether someone chooses to pursue recovery. Both are positive changes, and both are ones that we celebrate. We want to keep people alive and as healthy as possible to allow them to move toward positive change. Denying people the ability to have clean syringes does not mean that they're going to stop using drugs. It just means that their health outcomes may be worse and that they face more stigma and more illness. Finally, this program exists in community. We know that. That's why y'all are here tonight. We want our community to be as safe and healthy as possible. That's why, like Katie said, we installed an anonymous syringe drop box over there where people can safely deposit their sharps. As part of this program, we're doing monthly trash pickups around our neighborhood where we'll also be picking up any syringes that we see. And it's why our syringe hotline exists, which there's a flyer over there that has my contact information, and it has a phone number that you can text 24/7 if you see a syringe, and someone will come out and pick it up for you and safely dispose of it. We want you to feel safe as well. I want to go over a couple of the resources on that table before I wrap things up. First of all, though, Fat Daddies, can we give it up for them again? Thank you all so much for being here. We love you. They're just over on the tracks. If you haven't been there yet, you gotta go. Hopefully dinner tonight made you want to go. At this table over here, we have flyers, like I said, that have more information about our program. They're a little more detailed than the ones that you got when Hannah knocked on your door or the ones you may have seen on social media. They have a little more information. They have my phone number and that syringe hotline. For the science people in the crowd, we also have a fact sheet from the CDC on syringe service programs and the positive impact that they can have on syringe litter and people entering treatment. The CDC says on that form over there, people are 5 times more likely to enter treatment after utilizing a syringe service program. 5 times than the people who don't. Finally, we have naloxone available over here. Naloxone, if you don't know, you might have heard it called Narcan, same thing. It's a nasal spray that can reverse an overdose and save a life on the spot, and it is completely harmless otherwise. Can't hurt you, it's not dangerous. It's a nasal spray in a little package like the one I have on my lanyard. After we are done talking, you're welcome to come talk to me, to Katie, to Hannah, who's back there, or to Danielle, our chief nurse. Where's Danielle? Over there. With any questions that you might have about the program. You're also welcome to reach out to me directly. My email and phone number over there. Last portion, I promise. This is one part of a long process. We're not currently seeing anyone for this program. We got a couple more steps first before we can do that. Next week, we plan to put notices of our public hearing in the mail. This is not a public hearing, it's just a community meeting. We wanted to get y'all in here first, the neighbors from around the clinic. That notice will include a copy of our application to the state and a link to our full program policies and procedures. That's a 40-page document. I think I've thought through everything. We will see. For those of you outside the 2-block radius that will get mailed to, those will be available on the city's website for you to review as well. After that, we'll have a public hearing with City Council. Exact date and time TBA, we're still waiting to hear back from the city on that one. They're a little busy, with a regatta. Leading up to that hearing will be an open comment period where anyone is able to submit a comment. And after that will be the final City Council vote on the matter, which will likely happen in mid-July. All of that is just for the city part. After the city, fingers crossed, approves it, we'll get final approval from the county commission. And if that goes through, we will submit our application to the state. And let me tell you, I hope all that paperwork is enough to show you that we do not take this process or this responsibility lightly. I'm gonna pass it off to Hannah. She probably knocked on your door, may have left a flyer for you. She's gonna talk in a little more detail about some of the ways that you can give feedback and support us. So yeah, thank you all for being here and come talk to me. We're not planning to take public questions tonight. This is intended as more of a casual meeting. Y'all can come talk to us. You can ask us whatever you like. There'll be an opportunity for public questions at that formal public hearing that we'll be having soon.
And where is that going to be?
It hasn't been established yet. We're waiting to hear back final from the city.
So you're only mailing out to papers to 2-block radius?
Correct. We are only mailing to a 2-block radius. That is what the city asks us to do. For anybody outside of that 2-block radius, it will be within the city, or it will be on the city's website. If you have any more questions, please feel free to come ask them to me afterwards. I'm going to have Hannah continue and wrap us up for tonight.
Thank you guys. Thank you so much for coming. You might have seen me at your work, or I might have left a flyer at your church, or I might have knocked on your door and you answered, or you didn't answer and I left one in your mailbox. You might have seen a flyer in a local business on the ground all over the Westside. I can't tell you how many pieces of paper I have distributed across the Westside, across these 2 blocks. But all of that for today, right? And I'm so excited to see all the people come, for everybody to eat together. I come from a family of chefs and people who serve, so feeding and eating together is really important to me, and I think that there's no better way for us to come together and have these conversations than over some good food and some good music. So post today, right, we know that this is a first step into a long line of processes that we are just now really dipping our toes into. But there are ways that you can learn more information or get involved post today. So we were talking about our beautiful resource table that Iris is sitting at. There are a couple of things over there that I would love for you to take a look at. I have written a letter of support, a just generalized letter that talks about the CDC information and the program and why we feel the program is necessary for our city. If you support us and you want to sign on to that letter, you can just write down your name, the date, and the email, and you'll have signed on to our petition, but also you're putting your information so that when it comes to the time where we have more involved things like the public hearing and we get closer to that city council, we can show you how you can be involved. And then another thing, I would like everybody to do this if they are able to. I made a beautiful sign that says any positive change with a pretty QR code on it. If you could take your phone out and scan that QR code, it's got a survey for today's event. So it just asks a couple really basic questions, things like, I understand what the harm reduction program is. I feel comfortable explaining or referring somebody to more information. I understand what Narcan is. I feel like it asks you where you learned about our event, and it also gives you an opportunity to ask questions or leave any comments. So if there are any comments or questions that you really don't feel comfortable coming up and asking right now, please, please, please leave them in the survey and somebody will reach out to you directly to have a conversation. So once again, let's give it up for Iris because they worked so hard to put this together. One more round for Fat Daddies because they fed us so good. We're even gonna give a shout out to Matthew and Colby for providing all the sound systems and doing all the setup. And thank you to everyone who came. It's people like you in the community who come and join the events and make your voice heard and make your body seen that make positive change. So I can't thank any of you enough for being here.
Hold up, bro. Oh, she is too. Austin, can you smile?